Okay, well, good afternoon, everybody, and thank you for joining us. It's really wonderful to be here. So I'm going to just get straight into it. So I'm going to start with you, Heba. So I know you work a lot with the clinics, the MDT clinics, with the insulin pumps, and you see a range of adults. So I wanted your insight professionally as how we integrate the AI in your daily clinic.
Okay, first of all, thank you to bring me here to discuss this very important topic today. AI, it's a very important rule. It's a crucial rule in our diabetes education. It's like interacting between the AI. So let me ask a question. If we can prevent complication associated with type 2 or type 1 diabetes before it's happening? This is a digital platform. It's a play crucial role. It's not anymore like a vision. It's become our reality. We have a lot of patients connecting and using. So with this platform, we can help the patient to control their sugar by themselves, and we can detect the early sign of complication. We are talking about early detect of complication. So using these tools, it's working AI. Let me explain to you how it's working in our clinic. If there is advanced AI algorithm detected for the real-time data for the patient. Based on this data, we can take an action. So we can monitor the patient 24 hours, 7 days a week. We can see where is the fluctuation happen and the glucose variability. Based on this data, we can take action to prevent complication. It gives us more sign. There is early complication, so please take an action right now.
That's fantastic. And can you tell us a little bit more about what kind of glycemic metrics that help us with this control?
So there is HbA1c we can see, but nowadays we are not talking about HbA1c. So now we are talking time and range. We have a lot of patients using continuous glucose monitoring and different kind of insulin pump. We can see this one.
And from what I understand from working on these topics, and again, through the clinics when I do my rounds and sit with you guys, and when we teach also in structured education programs, which are open also for our patients, we get to discuss the details of how the data that sits on these platforms and its access can help us in real time intervene. So these, also have alarms like for if the patient is going through a hypoglycemic event, if their blood glucose drops, or the other way around, an alarm that beeps when they are over their blood glucose target. So we can, hypos, of course, are sort of more acute, right? And then
Definitely.
The hyperglycemia, we're talking about micro and macro.
So also this is the platform will help both of us. Mm-hmm. It's improve the communication between the patient and healthcare provider. It's give alarm for the patient, so they notify the patient you have a hypoglycemia, take an action right now. But it's not working alone. Also, our education input
I was
will
going to ask
help.
you about that.
Yes.
One.
And healthcare provider also can get the same notification in that platform. So I can offer them with the technology visual consultation.
Yeah,
I can call them and improve this one, and we can prevent complications
Before the things happen.
Yes.
Wonderful. Thank you very much. That's fantastic. Well, if I kind of take the theme further and kind of dig deep into our special population, the pediatrics. So the pediatrics is set up in a certain area upstairs on second floor, and it's super busy, and it sees at the moment everybody from as 1.5 years all the way to 18 years. And Farhia is part of the MDT team. So Farhia, my question is, how do we work with this unique population? Because obviously there's going to be a difference in how we communicate all this technology to the children and the carers.
First of all, thank you, Dr. Tumador, for your introduction. It was so lovely, and I'm so happy to be with such a lovely people today. Yeah. Can you hear me?
Yeah, that's better. Yeah.
Okay. So yes, absolutely. The AI-driven technology, it have a significant impact and significant potential when we are coming to the management of the diabetes and how it's improved the management of diabetes in the pediatric population. Although with the pediatric population, we have a significant challenges that come with it, which is the growth, the development, the emotional well-being. But all in all, when you keep in consideration the main component for that you and the main approach that you have to follow as a diabetes educator, creating age-specific education, behavioral platforms that you can use according to the child and their age. Definitely, it's improved a lot the glycemic control for our patient.
Fantastic. And because you see such a wide range of patients, I remember in one of the clinics, I've seen a patient who was under 2 years old, and it was very difficult for the parents to go through that insulin pump installation and then the CGM adjustment for the glucose monitoring. So can you tell me how diabetes education and AI can actually help in those clinics?
When we are talking about the pediatric, it's a little bit sensitive, the education that we are providing for them, because you are not only focusing on the caregiver, also you are trying to engage the child in the education and in the sessions to get the optimum outcome and to make their glycemic control better in the time. So yes, once in a while I was having that small child. He was 2 years old, and the family, they were really very hesitant to put for them the continuous glucose monitoring devices. Even though after the education and everything, they were still a bit hesitant, and they need usually more support than we do usually in the adult clinic. But with very, very specific structured education that we are implementing for this population, keeping in consideration their psychological and emotional aspect and covering all of the things, it was really positive outcome at the end. Yes, yeah.
And just perhaps one more point, the AI is quite complex. The CGM and the continuous glucose monitoring algorithm is different to the insulin delivery systems, whether they are sensor augmented, full, closed loop. So how do you manage not just the integration of this data, but meeting the patients where they are?
In the beginning, while we are using those, all the AI-driven technology are amazing, but when we are using them, I keep in consideration a lot of things, which is the level of education of the people, who are my patient and his parent, also the A1C also. And when we are going to the continuous insulin delivery devices, I'm speaking about the insulin pumps, we have different devices. We have the augmented one, which is connected with CGMs and continuous glucose monitoring. And aside from that, we have also the non-augmented one. At the end, it will be a personal choice, because at the end of the day, you want them to be convinced when they are applying this device and to be happy about it. This is the way that you are going to get the outcome that you want, and the continuity of the treatment with the device.
Thank you. Fantastic. I guess the best treatment is the one that comes with good compliance. So that's very important. Thank you.
Thank you.
Now, Amir, talking of difficulty of the challenges that we see with integrating AI in the young ones, what about adolescents? Because they also come with a different mindsets and criteria.
So, thank you, Dr. Tomadar, regarding for my invitation. Actually, with the adolescent, and the base of my experience in my clinic, if we are empowering the adolescent for the technology such as the insulin pump and the CGM, they will be engaged for managing their diabetes. Okay, and not these tools actually just for monitoring the blood sugar and help for the treatment protocol. It's also constantly providing for the autonomy health care for them.
I think autonomy is really important, and this kind of independence when you have algorithms that are really connected even to our phones. So a lot of these devices have applications that the patient can have, as well as their caregivers in children and adolescents, or even in sort of non-independent patients. So can you tell us a bit more about how you make sure that we do the best we can with that?
Yeah. Actually, we are providing for these ages, actually, as a group sessions, that they are talk about their experience and how to managing their blood sugar. Besides in that we need to list their isolation and improve their motivation regarding for the diabetes management.
And do you feel that there are particular age ranges, even within adolescents, that work better or are easier to work with when you talk about the technology, or is it really case by case?
Yeah, now actually we are in that time of technology, and most of the adolescents, they are using their mobiles, okay, and they has a lot of applications. Okay, some of our CGM that we are download there in their mobiles, and that it's easy access for us and the doctor that we can reach their data, and then it will help us regarding for the managing and the adjusting of the insulin or their treatments.
Fantastic. And for this age group, what is your interaction like with the carers and the parents, especially for those who are at school or college or university?
Yeah, actually, what we are doing, actually, we do as an instructional program for the parents and the adolescent that we talk regarding for what they are needs, okay? And we talk also for the CGM and the insulin adjusting, okay, and we do as a special programming between the patient and themselves. And even sometimes we are inviting them for virtual program as a presentation for the treatment.
Okay, so in person and virtually.
Yeah.
And do you need one session, 2 sessions? How many?
It depends for their acceptance in that. Actually, you know, the adolescent, sometimes they are accept whatever you have, but you have firstly to do a good relation between you and the patient. Otherwise, the patient, some adolescent, they will not hearing you well if you are giving them some like, do this, do that. You have to be friendly with them and give them as a consultant to involve you in your decisions and consultations.
That's a great point, to involve the patient in their care and for that accountability and responsibility. Thank you. So
Thank you.
Fetan, thank you. So Fetan, in your experience as a health and diabetes educator, now like our colleagues, they come from a nursing background. Yourself, you come from a dietetics background, and particularly for patients who use insulin delivery systems and insulin pumps. Can you tell us about how you integrate dietetics into your diabetes education clinics?
Good afternoon, everyone. Thank you all for attending. That's a very beautiful question. I think we are truly blessed to have the opportunity to deal with artificial intelligence and to have the ability to give this beautiful blessing to patients and to tackle it out according to their needs, to their cultural preferences, to their dietary preferences. In my clinic, as I come from a nutrition background and also from a diabetic education background, I think having the ability to use these CGMs and integrating it with all the systems that we have gives a better awareness to all the patients living with diabetes. They have better understanding what is happening exactly inside their body. I always tell them we live in a blessed time that we have the ability to actually detect and see how our biochemistry is behaving toward food, toward stress, toward everything that comes to your mind. When it comes to controlling your blood sugar, unfortunately, it's not only one aspect. We have multiple aspects we need to take into consideration. And having these tools and be able, to put it on a person's arm and monitor them for 2 weeks, and they would come back to us. And then we would download a full report that would actually show minute by minute what is happening throughout their day. Then we have the ability to fine-tune their doses if they are on insulin. Then we have the ability to tolerate and demonstrate individualized diet plan. I always say we can't say there is a common diet for everyone, but it's always better to have an individualized diet plan that meets their requirement, and mostly, as we live in UAE, that meets their cultural background and their dietary preferences. Because when I tell my patient, when it comes to diabetes, we need to understand that this is a chronic disease. Unfortunately, it's a progressive one. And so applying the treatment has to be chronic. But at the same time, I tell them there is a beauty in diabetes. And the beauty lies is that you, as an individual living with diabetes, you don't need to perform massive changes in your daily habits, or you don't need to do significant changes in your daily routine to achieve a change in your blood glucose. The beauty lies is that even walking after a meal for 5 to 10 minutes makes a difference. Drinking an extra cup of water makes a difference. Sleeping an extra hour makes a difference. Breathing for 5 minutes to reduce your stress makes a difference. And what's really beautiful is that you get to show this patient this real data. It's not an example of someone else.
I was just going to say, isn't it nice when you can actually show the patients their AGP trend, their glycemic control, and they can be directly involved in knowing what they can and what they should improve? Yes.
Absolutely. And as I told you, this is the beauty. This is their data. I mean, for all of us as healthcare professionals, it's always easy to talk to patients. But the important part is you need to engage their minds. You need to engage their behaviors. And once you let them to see this, I would say the download of the CGM itself, it would click in their mind. I always tell them, try it, experiment for 2-3 days. I won't tell you to stop that or add that. You will come back to me noticing, oh, I have noticed bread increases it. I have noticed, let's say, protein stabilize it. And as I said before, the general advice that we give to everyone doesn't really apply to everyone. You get to see individualized differences depending on their age, depending on their physical activity, amount of muscle they have, amount of stress they live in, a lot of things.
Fantastic. And do you feel that AI and algorithm-driven decisions from these technologies have helped in groups that find it a little bit difficult to stick to diets, between brackets diets, or eating patterns?
I always say it's always easier to change the medication than to change a lifelong eating habits. But with the presence of these CGMs, as I said before, patients get to see what's really happening inside their body. So they have an extra motivation. If I did that, I would get that result. And when it comes actually to diabetes as a chronic disease, we're not actually asking them for 100% perfection. I'm super happy if a patient comes to me with 70 to 80%. That's even more, I would be more than happy achieving that.
That's a pretty good number as well. So thank you very much, Faten. And Adam, I would love to tap into your experience of clinical operations and get your opinion on how you think healthcare systems should really evolve to not just accommodate, but to enable that translational sort of medicine and bridge efficiency and efficacy.
That's a lot of question.
Oh, well, I talked to you about it the whole time.
Okay.
So
So I've got 4 minutes. Let's go back a step. My job as any decent operations director is to stand behind you all in the background, very quiet, and making sure everything you do is financially viable, equitable, governable, safe, keeps you safe, keeps the patient safe. Now, once that step is done, once we're comfortable with it, it's making a palpable difference to the patient group, the patient cohort, just your experience day to day. Then the job is how do we extrapolate that out across the clinic, let's say pediatrics, adolescents, into adults, adult diabetes, into orthopedic therapy. So it's threefold, really, the response is keeping you safe, governing you appropriately, making sure the patients are receiving a positive and a good step forward in their care. And then it's how do we break the norms? As Hassan would tell us frequently, our job in this organization is to consciously break the norms, to advance healthcare in a different way, to not always do what we've always done to get the same response. And that is the next iterative step in that. We are taking those steps forward now in using AI, not to replace you, but actually to inform you. I said it yesterday, when I left nurse education in the late 90s, that was about the most educated I was ever going to be. We're now putting that in your pocket, and you're as educated as 15 seconds ago when M42 last updated itself. So that's the big step forward we're seeing now is you can rely on these tools. We encourage you to use those tools. In fact, we put those tools in your pocket, And that's the big step change we're seeing at not just at M42, but we are leading the way globally on that in let's make a difference today to your patient, and actually then ultimately globally. So,
absolutely, thank you. And so do you feel that there are certain things that we need to be a bit more astute in sort of how we think? Is it a change of mindset to match the change and the growth of the algorithms, or is it us kind of thinking forwards and working backwards to achieve what we need to achieve?
That's another big question. Okay, let's look at antibiotics discovered in the very early 1900s. Weren't really embraced until the 1950s, post-war. That took 45 years to get there. Look at trauma care in the early 2000s. A golden hour came around. It took us 10 years to embrace it. We're at the forefront of AI, and it's changing by the minute, by the hour, by the second. We heard yesterday, I think Carlos was saying every 72 days, medicine's learned more about itself than it knew the 10 years before. So there are big step changes coming. My job is to make sure, again, you're safe, you're governed, and that those steps are managed appropriately and have a palpable positive outcome for everybody. So yeah, we more than anything, it's encouraging. It's encouraging the team to use the technology that's available and embracing that step forward.
Yeah, thank you. It's definitely encouraging and interesting because now we're able to integrate a lot of systems with those, AI-driven and algorithm-based technologies to give us a more of a holistic approach to how we look at complex patients and complex populations that have chronic diseases that aren't going to go away for quite a significant amount of time. And it's not just, living longer, but living more healthily, that longevity and quality of life. So with that, I'd love to thank you all very much, my dear panel and our attendees for your time and attention. And thank you very much. Thank you.